Our heart is the most important muscle in our body, and yet most of us ignore it. We don't give it the attention and the importance it deserves until something goes wrong.
6 months after I qualified, my father passed away from a cardiac arrest, and I think that was one of the most massive life events. Everyone thinks of a heart attack, and you see it in Hollywood and Bollywood. You see people dropping dead,
Yeah.
and that isn't a heart attack. The underlying reason for that are narrowings in the arteries of the heart, which then become blocked. There's no excuse not to be informed. We have to understand our bodies. We have to understand our health. Bad hearts happen with bad habits. It's not that you're born predisposed to having bad heart health. So the best way to delay any problems with the heart.
Welcome to Social Untold. Hope you're all doing well. Today we're going to talk about a very important topic. It's about our hearts. Our heart is the most important muscle in our body, and yet most of us ignore it. We don't give it the attention and the importance it deserves until something goes wrong. For that, today we have Dr. Joban, a consultant cardiologist who specializes in heart health. He's going to help us understand how we can take better care of our hearts, spot early warning signs, and how to make small but impactful lifestyle changes, which will then help us with our life and our hearts. So, if you think this is something that would help you, or a family member, or a friend that you know, please keep watching and don't forget to share it. So, let's go. Welcome, Dr. Joban. How are you?
Good evening, Tamina. It's lovely to be here. Thank you for the invitation.
Thank you for coming. I want to start with a very basic question. Why cardiology? Did you always wanted to do this?
No, I didn't want to do cardiology at all. So I'll answer this question as to why medicine in the first instance.
Yeah.
So I'm an identical twin.
Okay.
And my brother and I, for people who know us, think of us as both being very relaxed, very chilled out people, except with each other. So we were very, very competitive. So my brother wanted to be an engineer, and so did I. But when I came to sort of choosing my career path, I wanted to do something different. And although I'm not a devout Sikh, I'm very proud of coming from this heritage. And an important concept in Sikhism is the concept of seva, which is selfless service. And I think a career in medicine is something that adheres itself quite nicely to that.
Absolutely.
And so, I went to medical school, loved it. It was fantastic. I left medical school wanting to be an orthopedic surgeon. And sadly, 6 months after I qualified, my father passed away from a cardiac arrest. And I think that was one of the most massive life events in my sort of young life. To then I was 24, 25. So that sort of sparked an interest in cardiology. And I was very lucky to be mentored by some excellent physicians. And, thanks to them, I guess one of the positive impacts of that life event was me sitting here today as a consultant cardiologist. And, it's a fabulous job. I feel I make a difference to a lot of people. I get a lot of fulfillment, and I won't change anything.
Great. We're so happy that you are a cardiologist. I understand it's so much needed. Like I was talking the other day with my one of my friends, and we were just saying that there are a lot of conditions that we see nowadays, which is so common. But back in the day, it was like a very rare situation, like, oh, okay, someone died of a heart attack or a cancer. But now it's like so common. Every other day, someone is passing with these. So we need a lot of doctors who are specializing in these fields. Yeah. So thank you for that.
It's okay. I think one of the reasons is that modern medicine has developed so much.
Yeah.
We're so good at diagnosing conditions, particularly early on.
Earlier, yeah.
10, 20, 30, 40 years ago, these conditions weren't recognized. So, I think that's one of the byproducts of medical advancement, is that we recognize so many conditions, and we can understand them, diagnose them early, and make a positive impact on people's lives.
Yeah, just that you just mentioned, it reminds me my grandfather died of a heart attack at the age of 55. This was about 35 years ago. And the doctors had no idea what was wrong with him.
Yeah,
Yeah.
it's devastating. It's
Yeah.
devastating. And I think, with living in a digital era, living in an era where information is available at our fingertips, and I think there's no excuse not to be informed. We have to understand our bodies, we have to understand our health, and, all the tools that are available, that are on our phones to be able to really positively impact our personal health.
Absolutely. So tell me, in your experience, what have you seen? What are the biggest misconceptions that people have about heart health?
I think that the one I'm confronted with on a frequent basis is, what people's understanding of a heart attack is. Okay, everyone thinks of a heart attack, and you see it in Hollywood and Bollywood. You see people dropping dead,
Yeah.
and that isn't a heart attack. A heart attack happens. People can have very insignificant symptoms: a bit of chest pain, a bit of breathlessness,
Yeah.
and that the underlying reason for that are narrowings in the arteries of the heart, which then become blocked. Whereas cardiac arrest is what most people misconceive to be a heart attack, when your heart's electrical activity stops suddenly.
Yeah.
One of the reasons for that can be a heart attack, but there are multiple other reasons. The other misconception is heart failure. Now, the one condition that is increasing in prevalence, and the most frequent diagnosis we make is heart failure. And giving that diagnosis to a patient, it can be quite devastating. But heart failure doesn't mean your heart is about to stop. It means that your heart's pumping action is inefficient. And over
Okay.
time, you can treat that very well, and people live, long and healthy lives with heart failure. So those are two sort of major misconceptions that I encounter really, really frequently.
Why do you think people delay in taking actions when they see these signs? Like, why do you think this happens?
That's a good question, and there's been a lot of research into that. I'm only going to speak anecdotally from my own experience. Look, the heart is in the chest, obviously, and the chest has lots of other structures like the lungs, a lot of nerves, and of course the stomach and the esophagus, etc., all inside the chest. And uh, heart disease can present very subtly with very sort of vague symptoms: breathlessness, bit of chest pain. Often people can misinterpret them as being pain coming from the ribs or the muscles,
Yeah.
or pain coming from the tummy. People feel breathless, they think they've got a bit of a chest infection. So, you can have these sort of vague and subtle symptoms that can actually indicate something very serious, but people misinterpret them. So that's a common reason. Often people are scared, and they may have symptoms, but they lull themselves into a false sense of security, and some people are afraid to seek help unless they get very, very desperate. So there's a variety of reasons, but generally speaking, I would say the chest is a very complex structure. There are lots of organs within the chest, and they can all cause the similar or same symptoms. So it's very difficult. And that's, I would always urge people, if you have a new symptom that doesn't feel right, always seek medical attention.
Yeah.
It's the job of an individual like myself to tease out those symptoms, use tests to understand whether they're significant or not. So look, you don't need to be a hypochondriac, but if you have something new that's persistent, always seek medical attention. You're not wasting anyone's time, would be my advice to the audience.
Absolutely. Um, what would you say? How would you describe a healthy heart? Or if I rephrase it, how would a person look like who has a healthy heart? Like,
Yeah.
are there any actual signs that you can see, oh, this person has a healthy heart?
Okay. There's sort of a few key indicators to a healthy heart. These include a heart rate. If your heart rate is a normal heart rate is between 60 and 100.
Okay.
If it's too low, too high, that can indicate a problem.
Okay.
Blood pressure is really important. Normal blood pressure is between 120/80 on average. Blood pressure is very fluctuant, so your blood pressure can be very high at certain instances, and it can be very low. So, and it's normal to have a variability. If your blood pressure is persistently above 140/90, these are the numerical measurements of your blood pressure.
Yeah.
That can indicate an issue. And the other issue is, I guess, the efficiency of your circulatory system. But what I mean by that is, do you have the stamina to carry out normal activities? Are you able to climb 2 flights of stairs without difficulty? For most people with a normal, healthy heart, that should be a very simple, or that should not cause any limitation. But if you're breathless on a few steps, that can indicate some problems with the heart.
Okay.
Numerically, we can assess that with scans, and we give the heart a number. It's called an ejection fraction. Don't want to get too technical, but that we can measure how much blood enters the heart and leaves the heart with each heartbeat.
Okay.
And if we give it a percentage, above 60, between 50 and 65% is considered normal. 100% is definitely not normal.
Yeah.
So the other important aspect to understand someone's heart health and whether they're in good shape or not is to look for things like their habits and their risk factors. If your blood sugars are very high, if you're diabetic, if you're a smoker, obese, these can often you can tell if from people's lifestyle whether they're likely to have a healthy heart or not. But these are the kind of sort of factors that I judge when I'm assessing someone's heart health.
Okay. You said diabetes. So I'm diabetic. I'm type 1 diabetic, and I've never had blood pressure issues. So it's always been normal. Um, I think I can do the stairs flight for 2 flights as well without any problems. I think I'm trying to be more active. Do you think my heart should be okay? Because I feel like I'm asking this because it's in the family, right? I always had this in my mind that my grandfather died with it, so I always try to be as active as I can. But since you mentioned diabetes, if that is well controlled, it shouldn't be a problem, right?
Look, I mean, the two, obviously, as you're aware, the two types of diabetes. Type 1 is one that occurs in young age.
Yeah.
That's usually not genetic. Whereas type 2, which is very common, particularly amongst the South Asian population, that has a genetic predisposition. And often type 2 diabetes comes on with people who are overweight, who don't do regular exercise, make poor dietary choices. But in type 1 diabetics, that your body is unable to handle sugar because of a hormonal deficiency.
Yeah.
If you look very slim, if you maintain high levels of physical activity,
Yeah.
your blood sugar is well controlled, and there's a blood test that can be done to assess your blood sugar control over a 3-month period. If all that is satisfactory, not a smoker, there's no reason why you should develop heart disease at a young age. So it's of course type 1 diabetes is a very important determinant of heart disease, particularly in younger people, but only if your diabetes is not well controlled. So if you're diligent about what you eat, you're diligent about taking your insulin therapies, and whatever other medications that are prescribed, there's absolutely no reason why you should get heart disease prematurely.
Okay, fingers crossed.
Fingers
I think
crossed.
I'm okay.
Absolutely, absolutely.
How does a heart change with age?
Okay,
I'm sure it has some effects, right?
It does, of course. And age in itself is a risk factor for developing heart disease.
Yeah.
So the older you are, the more likely you are to get heart disease. So answer that question, it's important to understand the 3 major components of the heart. One is the electrical system, one is the pumping action of the heart and the structures within the heart, and the third I like to refer to as the plumbing, which is the blood supply to the heart.
Okay.
So firstly, in terms of the electrical system, do you know how many heartbeats you have in a 24-hour period?
I'm not sure.
Okay, it's 100,000.
Oh, wow.
Okay, so you have 100,000 heartbeats, and your
Wow.
heart is designed to last you at least 80 years. But you can imagine it's working very hard by the time you get to 70 or 80, and the heart's conduction system can fail on you. And when you're not getting the necessary number of heartbeats, then a pacemaker can help in that situation.
Okay.
So as you grow older, the heart's ability to generate a heartbeat once you hit 80 plus may potentially become an issue. Not for everyone, but it's very common. In terms of the heart pumping action over time, natural consequence of aging is that the heart becomes stiffer, and that can present with fluid retention and some of the symptoms of heart failure. It's not really heart failure; it just means your body isn't able to cope with the work that is required of it, so people can present with breathlessness. The structures within the heart called heart valves, and think of these as gates or doors within the heart that control blood going from one chamber to the next. And if you've got 100,000 heartbeats every day, these these structures within the heart will open and close 100,000
Yeah.
times every day. So over time, these structures can wear and tear, and it's very common. You go beyond the age of 70, 75, some of these structures within the heart may need replacing. Again, one of the natural consequences of aging is that your arteries harden. And eventually these can get blocked and they may need to be opened up. But again, if you modify your lifestyle, if you avoid smoking, maintain a good weight, exercise regularly, follow a good diet, then you can delay a lot of these inevitabilities to much, much later in life.
Yeah, makes sense. Um, what's so in terms of your patients, what have you seen? Like, what is the most surprising thing that your patients find about heart?
I think
Something you mentioned to them, and they're like, really?
I think most people don't really. I'll come back to my previous point about the number of heartbeats you have. I think most people don't really understand that the heart is working really, really hard. So, vast majority of the patients I encounter are elderly patients, 75 plus. Okay. And when you tell them that actually you need a pacemaker because your heart, is now it's beginning to get knackered. They don't really understand. Why has this happened to me? This is terrible. But they fail to appreciate that your heart is a phenomenal organ. From the moment you're, and in fact, from the moment you're conceived in your
Yeah.
mother's uterus, it is working really, really hard.
Yeah.
And it is the design is so fabulous. It's designed to give you 100,000 active contractions every day. And the fact that it lasts up to 80 years and does so efficiently, people fail to understand what a phenomenal mechanism
Absolutely, yeah.
the heart is. So I find explaining this to patients, they're always a bit surprised by that concept.
Yeah, I can imagine. Like you just mentioned the heartbeats in a day, and I was surprised to get that number.
Everyone is. When I discovered that, it's awe inspiring. And actually, if you take the heart out of someone's body, they'll still carry on beating. It's phenomenal.
Yeah, yeah, I've seen that in few of the series, and
Yes.
it's like,
No,
oh
it's
my
true.
god, can they do that?
No, it does. So often, sadly, when people are involved in road traffic accidents and they're kind enough to donate their heart, you often see the heart is then it's taken out. It'll carry on beating. It's phenomenal. It's absolutely phenomenal.
It's an amazing organ. Yeah. Um, let's talk about some of the risks and the warning signs of the heart disease. Right. What are the most common risk factors for heart disease that people should actually, just take some time in their lives and try to spot these warnings?
Yeah, that's a really important question. There are two types of risk factors. Ones that are modifiable and ones that are non-modifiable. There's nothing we can do about it. Okay. So I want to really just briefly touch on the non-modifiable because it's important to know, but there's nothing really one can do about it. We know that heart disease occurs more in males. Can't do anything about that.
Okay.
There's certain ethnicities that are predisposed to heart disease. Sadly, South Asians. Sadly for us, South Asians,
Yeah.
it's very, very frequent. A lot of my research was looking at heart disease in Indians versus Europeans. And when you account for conventional risk factors, Indians have a twofold higher prevalence of heart disease and 3 times more diabetes. And we don't really understand why. Your genetics, after the genome study from the sort of 90s and the noughties, we've understood so much more about genetics, and we know that there are lots of genes that predispose to heart disease. If you've got those genes, you can get that information, but what do you do about it? We don't know. So these are the sort of non-modifiable risk factors, which we can't really do very much about currently. That may change. What we can do something about are the modifiable risk factors, and it's really important. So your blood pressure, your diet, your weight, whether you smoke or not, you're diabetic, the amount of physical activity you participate in. These are all play a critical role in your heart health and maintaining your heart health to good levels. So first, blood pressure. Normal blood pressure is below 140/90. What you can do to maintain good levels of blood pressure is to exercise regularly, reduce the amount of salt in your diet. Diet is critical. For those who eat meat, avoiding saturated fats. The best diet is considered to be the Mediterranean style diet. So we know that people who live in the south of France and Italy, they routinely will live up to 80 or 90 years. They don't eat they eat lots of fruits, vegetables, fish,
Yeah.
and no processed, ultra processed foods. So we know that's very, very important. A useful tip to the audience. I've treated a lot of patients who've had high blood pressure, have had poor diets. A very useful lifestyle intervention to make is intermittent fasting. For those who are not diabetic, if you restrict your feeding to 8 hours a day and fast for 16 hours,
Yeah.
it has an amazing effect on your blood pressure, amazing effect on your blood glucose control. And I've seen people lose 2 or 3 stones in 6 months. It's a really fabulous intervention. I don't need to educate anyone about smoking. Anyone who smokes, you really are increasing your risk of heart disease, cancer, all kinds of lung diseases, several fold. So smoking is an absolute no-no. Exercise, really, really important. You don't exercise to lose weight. Exercise to get your heart working. It's like any other muscle. It needs to be stimulated for it to remain in good working order. So really important. Don't have to run a marathon. Don't have to join a gym. 30 minutes of brisk walking so that you're sweating, not just a simple stroll, but a brisk walk is sufficient. We know the older you get, cardio is very important, but also resistance training, weights are also very, very important. The older you get, it's again a natural consequence because of the hormonal changes, your muscle mass reduces. It's really important that you participate in a little bit of weightlifting to maintain your muscle mass, because that avoids frailty, and that is positively correlated with good heart health. The last thing I want to mention is cholesterol. So cholesterol is again a big risk factor for heart disease.
Yeah.
Cholesterol is a normal constituent of the body. We need cholesterol for many of the mechanisms within our organs, but if it goes too high, it can preferentially be deposited in the arteries of the heart and cause blockages.
Yeah.
So we need to keep that below a certain level, mainly through our diet.
Yeah. Perfect. I know you touched upon this earlier briefly, but can we quickly again talk about the warning signs? Usually everyone knows that, okay, if you have a chest pain, that could be a sign. But what else?
Okay.
I know dizziness is there, but I don't know if I know any other sign.
Okay. No. Yeah. The beauty of the beauty of working with patients and working with human beings is that one person's heart attack or one person's angina, which is a type of heart disease, or one person's heart valve disease will be very different from another. So there's a multitude of symptoms that you should all be aware of that may indicate an issue with your heart.
Yeah.
Of course, there's the classical chest pain.
Yeah.
The classical chest pain that's associated with heart disease, significant heart disease, is it's not painful. It's a pressure on the chest. It can travel to the neck, the left arm, or the jaw. There are very few things that travel to the jaw. So if you're experiencing chest pain that goes to the jaw, I would be very suspicious there may be a heart issue. Okay. And similarly for the left arm. Chest pain from the heart is not usually painful. As I said, patients feel it as a pressure. It tends to come on with exertion, typically on inclines. But when you stop exercising, it disappears. Okay. So if you're getting chest pain that's related to exertion, that may potentially be related to the heart. Other important symptoms that are related to the heart are breathing difficulties. So if you get breathless on minimal exertion, that can, or any degree of exertion which is unusual for you, that could indicate an issue with the heart. Palpitations. Patients find describing palpitations very difficult. What I mean by palpitations is a heightened awareness of your heart beating and your heart beating rapidly. Okay, and there's a variety of different ways this can present. It can be a tapping in the chest, a thrusting in the chest, skipped beats, missed beats. All these may potentially be important.
Yeah.
And as you alluded to, dizziness, yes, dizziness and the sensation or some patients report a sensation where they're about to lose consciousness, but don't lose consciousness. Any loss of consciousness that occurs without warning is a very serious symptom. Any loss of consciousness that occurs with trauma, such as a head injury or broken wrist, again, very, very important. So I often see patients where their heart goes really, really slow, walking down, and then they find themselves on the bottom of the stairs and they don't know how they got there. So any loss of consciousness without warning, again, may indicate an important problem with the heart.
Can people have any heart issues without any symptoms at all? Is that possible?
In my experience, it's relatively rare, but it can happen.
Okay.
So you will hear about cases where people, someone very well, no symptoms, they're found dead in bed, the following morning, because they've had very significant heart disease, but they had no preceding symptoms. That does happen, but relatively rare. Some people can present with unusual symptoms, such as nausea, feeling unusually fatigued. It tends to be more common in women, actually. Women tend to present with in unusual ways. But in my experience, most people will, if you dig deep enough, will have the usual classical symptoms or some facet of the classical symptoms. So just because you don't have symptoms, yes, it's very possible there may be something very significant underlying. But in my experience, that's relatively rare. So I don't want people to be really afraid that they may be sitting on a very critical issue with their heart. It is very unusual for there to be something very drastically wrong, and you don't have any symptoms. Your body has a way of warning you, of telling you, which has been my experience. But of course, as I said earlier, the beauty of working with human beings is everyone's different. If a car makes a noise, you know what's going on because they're predictable.
Yeah.
Human beings are very, very unpredictable.
Okay. You mentioned women experience symptoms differently than men. Can you elaborate, like differentiate both?
I think women are more stoical. Men are. I think women are are mums. They're multitasking and they absorb much more than men. I see that all the time in the many procedures I do.
Yeah.
It's always the boys who will start crying. So I find that women are much more robust. And if they do experience chest pain, they're much more likely to not want to bother anyone. Much more likely to say this is not very significant. So we also know that some of the studies have indicated that women are more likely to present with unusual symptoms. So if they're having a heart issue, potentially a heart attack, may not have pain, more likely to be breathless, a bit nauseated or lightheaded or dizzy. No one really understands the reasons why.
Yeah.
But my experience is that I think that women are made much more tougher than boys.
They are, absolutely. And what about blackouts? Are that also
definitely
part of it? Can it be a symptom?
Definitely. So I mentioned loss of consciousness. Any loss of consciousness that occurs without warning is a very, very serious symptom. Okay. And one would hope that you never get to a stage where you're having blackouts.
Yeah.
Again, I'd like to reiterate that 90% of cases, it's very unusual that the first presentation of a heart problem is a full-blown blackout where you experience trauma. There's almost, if you dig deep enough, there will always be sort of subtle symptoms that predate that. But definitely blackout we deal with a lot of blackouts, and those are one of the most concerning symptoms we encounter and treat. But again, depends on the underlying cause.
Yeah. So it's always to actually listen to your body.
Definitely.
Whatever it's saying, yeah.
Definitely. Your body will tell you, in 90% of cases, which is the vast majority of the patients I meet, there are warning signs before a catastrophe happens. So listen to your body.
Yeah. Okay. Let's talk about lifestyle and everyday changes, right? How much does diet and exercise and sleep can actually help? I won't say fully affected heart, but like, let's say if a heart is actually, can I say damaged 10, 15%, 20%? But if you improve your diet and your exercise and your sleep, can it revert back to normal? Is that possible?
It depends on what the underlying issue is. So I mean, the heart is phenomenal, as I mentioned.
Yeah,
100,000 heartbeats. In every day, it's sort of the work it does is the equivalent of sort of 45 kilos being pushed for 1 mile. That's the amount of work it does. So the heart is really strong and really robust. But one of the shortcomings with the heart is that if it is damaged, it is almost, if the heart muscle is damaged, it's irreversible currently.
Okay.
So if you've had a heart attack where part of the heart dies, or if you have a very weak heart muscle, in vast majority of cases, it's irreversible. That's changing. There's a lot of interest in stem cells and other therapies looking at trying to regenerate the heart. But once the heart is scarred and damaged, currently, you can't reverse it. But, you do have a small degree of heart damage, you can maintain your heart health so things don't progress.
Okay.
So, the things I talked about earlier, maintaining a healthy diet, Mediterranean-style diet, intermittent fasting, avoiding cigarette smoking is number one, exercising regularly, have a beneficial effect on your heart, but they also have a beneficial effect on your mental health, which, has an overall effect on, on your well-being and the rest of your body.
Yeah. And you mentioned exercise earlier. I think brisk walking for 30 minutes, that's what you suggested, right? It's a minimum every day.
That is the absolute minimum.
Okay. That's a good start for everyone who's not doing that.
It's easily done, but it's not just, like as I said, you've got to be sort of, developing a bit of a sweat at the end. I think of my mum going for walks, when she was around, and it was just, a stroll with her friends around the neighborhood.
Yeah,
that's not what I mean. It's it's a proper brisk walk, and for people who have dogs, taking them for a walk, that kind of thing is excellent. Is enough. And that's it's a starting point. And how far you wish to take that is down to the individual. Again, one of the messages I want to get across is cardio is very good. So walking, getting your heart rate up is very good. Please don't neglect lightweight training and resistance training. Really, really important. So these are bodyweight exercises, things like press-ups, pull-ups, that kind of thing are really important to maintain your muscle mass as well as maintaining your cardiovascular health.
Absolutely. I feel like these days with busy schedules, people are just like, after 9 to 5 jobs, they just want to go home, change, relax, and get in the beds. But I feel like it's so important to actually get that 30 minutes for your own life and just go out.
My experience is that, if you're convinced in your mind it's important, you'll make time for it.
You'll make time for it,
I'll give you my example. 8 years ago, I was probably 5 stone heavier than I am now. And we have children. Children change your perspective on life. And my dad died when I was 55. When he was 55, I want to be there for my daughter, and hopefully my grandchildren. And things that changed my life were intermittent fasting and slowly building up exercise. I've done 3 half marathons now. Wow. So if I can do it, being morbidly obese all those years ago, anyone can do it. But it's a mindset. It has to be right in your mind.
Absolutely.
If you can convince yourself something is important, you will always make time for it. If you're making excuses, it's not important in your life.
Come on, guys, buckle up. Okay, we spoke about stress earlier. I cannot talk less about stress, how it ruins your life, how it ruins your heart. Can you tell our audience a bit more about this?
Yeah, stress is tricky because, stress is not something we can measure, so we can't test it scientifically.
Yeah.
Okay. So, in my experience, stress can have a really detrimental effect on the heart. Okay. So there's acute stress and chronic stress. Acute stress is, again, we've all seen it in the Hollywood or Bollywood films, the shocking news, and someone, clutches their heart and then they pass away or collapse or whatever. So, that's a very real thing. So if you hear some really shocking news, the body releases a lot of adrenaline, and that can mimic a heart attack. It can even have the same consequences of a heart attack.
Okay.
That's called a stress-induced cardiomyopathy, or Takotsubo, the technical terms, but that doesn't really matter. So, acute stress can be very harmful. It can mimic a heart attack. In fact, it can have the same effects as a heart attack. And if it's picked up early and treated, it is one of the important illnesses that's completely reversible.
Okay.
Chronic stress is more difficult And there's no doubt about it. If you're exposed to chronic stress, your adrenaline levels, your cortisol levels, which are hormones produced by your body, are very high. They cause your blood pressure to be elevated, and that has over time has a very detrimental effect. My experiences with patients who have high levels of stress, they then take on, they have coping mechanisms, and these are often unhealthy coping mechanisms: alcohol, smoking, eating badly, and that over time will have a detrimental effect on your heart health. So, but chronic stress per se, because we can't measure it currently, it's very difficult to say exactly how it affects stress. So these are more sort of indirect type sort of inferences.
Okay. So if you have to kind of sum it up for our audience, like for one simple lifestyle change that can actually help them, what would you say?
Without doubt, intermittent fasting. It changed my life as well, and I'm a big advocate. I think, and this is for non-diabetics. I don't want. I'm not a diabetic diabetes doctor, and I wouldn't want to advise anyone who's a diabetic. But for non-diabetics, intermittent fasting is really powerful. What this means is you restrict your feeding window to 8 hours a day, and fast for 16. So what most people do, what this means, skip breakfast, have a first meal by midday, have dinner a little bit earlier, 7 or 8. In the fasting window, vast majority of that time you're asleep, so it's easy. Water, black tea, black coffee is all that is allowed. The first 2 weeks are really difficult, but once you achieve that, I've seen people lose 2 or 3 stones in 6 months. It's been phenomenal. I had a massive weight loss myself, with that intervention. There's a really famous study from San Diego. I forget the team, but a South Asian guy from San Diego did this research where he had 100 rats, genetically identical. Half, they split them into 2. Half could have 1,000 calories whenever they want. The other half could have 1,000 calories in a restricted feeding window. And those rats were not obese. They didn't get diabetes, and they lived longer. And so intermittent fasting has a positive effect on your body weight, blood pressure, your glucose control, your sugar control. So I tell anyone who's prepared to listen about it.
Okay. If you have to name 5 foods that are worse for heart, what would you list? So let's say,
okay, so
I'm sure there are so many.
Yeah, definitely saturated fat. So anything that's high, so saturated fat is really bad because of the effects it has. It's very high in cholesterol, and that can impact the arteries of the heart. That's not good.
Yeah.
Anything
so what would come under saturated fats?
It's usually red meats,
meats,
full fat dairy products, cheese, that kind of thing.
Okay.
We know that anything that's ultra processed, so that comes out of a packet, lots of chemicals, must avoid.
Okay.
There are lots of carcinogens within them. They're really terrible. Any food that has a high glycemic index, what this means, when you eat it, your blood sugar goes really high.
Yeah.
You get a sugar spike. Those are terrible. The technology is available for everyone's different. Okay. Your sugar spike will be very different from my sugar spike. You can buy this little sort of patch. You may have, as a type 1 diabetic, you may have this.
I have it. Yeah.
Where you can monitor your blood glucose.
Yeah.
Okay. And I urge everyone to do this. It's not very expensive. It's about 30 or 40 pounds. Put this patch on and eat the various foods, and you'll be shocked kind of food products that cause a spike. When you get a sugar spike, your body releases insulin, which is a hormone, and the purpose of insulin is to, in simple terms, to take the sugar and convert it into fat.
Yeah.
If you can minimize food exposure to these to these sugar spikes, you can minimize weight. You can minimize weight gain and the detrimental effects associated with weight gain.
Okay.
So those would be my top 3.
Okay.
The rest are really obvious: sort of chocolates, Mars bars, that kind of thing.
Okay.
Okay. But saturated fat. Just summarize: saturated fat, ultra processed foods, buy whole foods. If you and prepare it yourself.
Okay.
We all lead busy lives. We've all got families. We've all got friends. We all have to exercise. When do you make the time to cook?
Yeah.
I spend Saturdays and Sundays, Sunday afternoon batch cooking, with my daughter. And it's a fantastic exercise. But I know that my family will be getting nutritious food during the week, and I can't recommend it highly
Okay. Quick question. So my mom, she's gonna kill me for this.
enough.
She recently, I don't know, she saw it somewhere online or what, but she made the ghee at home, right? With the actual butter she bought from, I don't know, supermarkets. She somehow cooked it at home and then prepared that ghee, and she is now making everything in that ghee. Is that good? Because she said she read it that this is homemade or something, or this is really good for your
Yeah,
health, but
yeah,
I'm not sure.
it's very difficult. Again, generally speaking, the fats that you should avoid.
Yeah.
Okay, so ghee is a type of fat. Okay, so and animal fats are, some people say they're good, some people say they're bad. I'm not 100% sure where I sit on it. But the kind of the fats that you must avoid are seed oils. So anything that's come from rapeseed oil or sunflower seed oil. These have been proven to be detrimental to one's health.
Yeah.
If you're going to use any kind of fat, without doubt, olive oil is the best, and ideally, extra virgin olive oil. And no one really understands why, but we know that in places where people live up to 90 or 100 have excellent heart health.
Yeah.
The common factor is the people who use olive oil, and that's in the south of France, Italy, etc. So, but ghee itself, there's a body of evidence that says any animal fat is detrimental. Some people say it's better than seed oil. So, but it's a better choice than sunflower seed oil. The best fat that you can take without doubt is olive oil. But I guess it doesn't really lend itself to South Asian cooking so much.
Yeah, true. And I sometimes tell my mom that I'm sure ghee would be nice, but it would be good for your health compared to other oils. But maybe we should see the quantity that we are having, and
I think it's like with
plus the physical activity that we're doing every day.
it's everything in moderation. Okay,
Yeah.
At the end of the day, we have to live, and I understand that, and I say that to all my patients. Whatever you do has to be sustainable.
Yeah.
Okay, you can not eat for 3 months and be in fabulous shape. That's not sustainable. It's the same with the fat loss injections. Most people you're allowed currently only allowed them for 2 or 3 years. After you stop taking those injections because you can't sustain that reduction in your dietary intake, people put weight back on.
Mm.
So whatever interventions you decide to make, they should be small, they should be sustainable. That's the key, to have long-lasting benefit.
Okay.
And
Okay.
absolutely, we have to live. You want to have a chocolate once in a while, that's fine. What is a problem is a chocolate every day or every other day.
Yeah.
That's the issue. So that would always be my advice. It's whatever you do, it's got to be sustainable.
Yeah. Okay. So we talked about the worst foods. Can you name a few good foods for heart health?
Okay, olive oil is number one.
Okay.
Okay, extra virgin olive oil is number one. We know that the best type of diets are Mediterranean style diets, which are rich in fresh vegetables. So and important thing that they're not processed. Okay.
Yeah.
In terms of people who eat meat, white fish or lean chicken is the best, in preference to more sort of fatty meats or red meats.
Okay. Okay. And is blueberry actually really good for heart? Because I see that everywhere.
Really? I'm not aware. We know that berries per se, compared to something like apples and pears, berries as a group, they tend to have a lower glycemic index. What that means, if you eat them, you get a smaller sugar spike.
Okay.
So berries in general are considered to be probably the best. Of the fruits, but blueberries specifically, I'm not sure.
Yeah, because when I go to supermarkets, they have like so many berry drinks, and it says great for heart, and all that. Make it sort yourself. Of promotion.
Anything that's in a packet
it's not good.
It's not good for you, because anything with the E number, anything that's processed, anything that comes out of packet is not good for you. I'm sure if you make, the best thing you could do is just buy some berries and blitz them. That's the best. Okay. That's the best drink you can have.
Yeah. Okay. Let's talk about the medical care and checkups. At what particular age do you suggest that people should actually start? Maybe just getting heart checkups, like go to the doctor, get it checked.
Okay. Look, heart disease can present at any age. So it can happen in children, it can happen in young adults.
Okay.
Okay. And there can be some very, very serious conditions that can occur in youngsters. So it's really important, if you develop any of the symptoms we've talked about or any of the signs we talked about, that you seek urgent
Close to you.
medical advice.
Yeah. Okay.
But for people who are, the usual person who's got, feel invincible until the age of 40, then, become a bit more aware of your mortality. So the NHS will provide screening or a kind of health check at the age of 40, and everyone's eligible for that. So, but I would say if there are any symptoms, age is totally irrelevant. But if you've had no heart problems in the past, then 40 is is the age to where you may want to be assessed. And the important thing you want to look at are those modifiable risk factors we talked about. Are you diabetic? Do you have high cholesterol? Your weight? And, weight is also really important. It's not just your body mass index. If you've got weight that's preferentially around your abdomen, you can be very slim.
Yeah.
If your abdomen is, if most of the weight is around the abdomen, that is, that's a real predictor for really poor outcomes later on in life. Okay. So at the age of 40, the importance of going at 40 is this is the time when you can do something about it if there's something that needs to be remedied.
Okay. Yeah. What about the tests? So we talked about the checkups, right? Let's say someone is in his 40s, right? And he goes to the doctor. So what tests would the doctor prescribe, or if a patient needs to go to a doctor, like especially if we talk about people back in our countries, right? India, Pakistan, there you just go to the doctor and patients tell the doctor, I have this issue, do that test. So if those people are listening to us, what tests can they actually go and speak to the doctor about? Like, can you check that?
I think definitely an ECG, which is a tracing of your heart. Okay. That's a good place to start.
Okay.
But a normal ECG doesn't mean that there's nothing significant wrong. I've seen people have full-blown heart attacks with normal ECGs. But an ECG is an important place to start, because there may be subtle things within the ECG that
warning signs or something. Yeah.
Exactly. The other important sort of screening tests are blood tests, and ones that come to mind immediately are three. One is your blood sugar levels, and not just a random glucose, but there's a blood test called HbA1c, which you're obviously familiar with.
Yeah.
So this is a blood test which measures your blood glucose control over the last 3 months.
3 months.
And we now diagnose diabetes or pre-diabetes with that.
Yeah.
So if your control is not quite in the diabetic range, but getting close to your diabetic range, that's pre-diabetes. That's really important to recognize, because that is definitely reversible.
Okay.
I'd also want to know my cholesterol levels. So within your cholesterol levels, there's good cholesterol, bad cholesterol, and other types of fat. So that again, if your cholesterol is very high, if your cholesterol is really, really high, that may suggest that you have a genetic predisposition to heart disease at young age. So it's a really important thing to screen for. Having high cholesterol doesn't really have any symptoms, so that we can only really diagnose that from a blood test. And the last test, if I was requesting for my own heart health, there's a test called Lp(a), and this is which stands for lipoprotein A.
Okay.
We know, so this identifies people who are genetically at risk of heart disease at a younger age. So there's nothing we can do about this blood test. We don't have any medications. If your Lp(a) levels are high, there's nothing we can do about it. There's no medications we can prescribe, but it identifies an individual as being at high risk for heart disease. The modifiable risk factors like weight, smoking, exercise, those can be addressed, and addressed aggressively. So those are the kind of things I would want as part of a screening test.
Okay. And how often does a person should get checked?
Again, people don't need to be a hypochondriac about it. You don't need it every year.
Okay.
If your tests are completely normal, then, and there's no other sort of important issues like a strong family history of heart disease in younger individuals within your family, then every 5 years is completely sufficient. You don't need to have it every year. But, if the tests demonstrate an issue, then every individual will require, a tailored follow-up.
Okay. And even if your test came out clear just between those 5 years, like you said earlier, listen to your body, listen to
Definitely.
the symptoms.
Definitely. And, it is very unusual to develop anything bad if you don't have some symptoms. There are always symptoms. So if there's
Okay.
any change, no one's wasting anyone's time. Please be forthcoming.
Okay. How would you reassure your patients who are very anxious about their heart issues?
That's a difficult question. Um,
Like, sometimes it happens like a doctor prescribes, let's say, 10 tests, and the patient would just get up all like, oh my God, why am I getting so many tests? And they stress about it even more.
I think the most important thing is really good communication between a doctor and a patient,
Yeah.
and spend time, to discuss. I'm requesting these tests, and these are the reasons why. Because I understand the anxiety of having, a raft of tests being requested, and then the anxiety of waiting 2 to 3 weeks for those results to come. On a personal level, I understand that anxiety.
Yeah.
So if you request a huge number of tests and don't educate the patient, or educate's the wrong word. If you don't inform the patient as to why you're
Why
doing this
you're
test,
doing
what
it.
are the results, and what
Yeah.
are the implications, then I think you are doing a disservice to your patients. So I spend a long time. I only request the tests that are definitely required, and I always justify the reasons for these tests. And if I'm expecting something serious, I will always explain to the patient that these are the possibilities. And look, I'm never going to sugarcoat anything. It's important that you're frank, you're honest, so that if you do get a significant result, the patient is prepared for that.
Yeah. Yeah. True. Um, is it true that only older patients should worry about their heart health? I
Uh,
mean, especially I would say, I don't think teens would really worry about anything like that.
we've all heard about the young footballer who suddenly dropped dead at the
Yeah.
so heart disease affects everyone. Okay, of course it becomes much more frequent the older you get, and it is a myth to say that heart disease only affects people above a certain age.
Yeah, that's a general perception. Like, it's
Yeah.
for the aged people,
So
issues. No, youngsters don't get it.
you'll be surprised.
Yeah.
Part of my training was at the Brompton in London, and Brompton, other big sort of heart hospitals. There's a whole department dedicated to people with heart disease from young age. It's called congenital heart disease. So
Okay.
you will see people, babies who are 3 days old will be operated
Oh,
on. So heart disease happens at every age. Thank goodness it's not that frequent. But any individual, agnostic of their age, if they have any symptoms to suggest heart disease, must get checked out. Really common. I very recently saw a 23-year-old who I referred for heart surgery because they were born with an abnormal heart valve, and that had degenerated rapidly. So we see heart disease amongst the full um, breadth of different age groups.
okay. And we know that the people who are suffering from obesity, they have more risk of heart issues, right? But what about people who are actually slim or who are more active? They're still not.
Yeah, no,
Uh,
it's a obesity is obviously an important risk factor, but
yeah.
it's only one facet. And as I said, you may be slim, but if you've got you if your fat is primarily around your abdomen, even though your body mass index is below 25, which is a normal range, then you're still at higher risk. And obesity is one thing. Just because you're slim,
Yeah.
doesn't mean you can smoke. Doesn't mean you can have an unhealthy diet. But absolutely, if you are slim,
Yeah.
then that's an important part of the jigsaw puzzle of your good heart health. But there are many, many different cogs that need to be aligned: weight, blood pressure, um, blood glucose, and all the things we've talked about.
Yeah.
But yeah, it is a myth to say just because you're slim, you're then protecting yourself from heart disease. In fact, there's a lot of data to suggest if you're slim and you do too much exercise,
Yeah.
your heart can get inflamed, and that can predispose to heart disease. Can be a risk factor of heart disease if you exercise too much. So it's very, very complicated.
I was coming to that question and you mentioned this. So I just want to touch a point here. We are seeing a lot of active people, like especially people who are actually going gym or who have, like, especially let's talk about celebrities, right? We've seen so many deaths in the past few years. What is happening there? Because outside, a person seems very normal, active, there's no other symptoms, and just randomly they went to the gym one day and they had a heart attack. How does that really, like, because usually you said diet, exercise, sleep, these things should help us, right?
Definitely.
So it's very contradicting to understand how can excessive exercise actually be really bad for your heart.
So it's like a U-shaped distribution. No exercise is terrible.
Yeah.
Small amount of exercise very good. Too much exercise can be detrimental to your heart health. Pushing your heart, I come across all the time. People cycle 100 kilometers twice or thrice a week, or people who are doing ultra marathons regularly, and you see them and you wonder why they're having heart issues. If you push yourself really, really, really hard, then your heart obviously is unable to cope, and the heart's electrics can be affected in an adverse way. So we see a lot of patients whose heart rhythm becomes irregular as a result of excessive exercise. There's a group of veteran exercisers, so people who didn't really do much during until the age of 40, become conscious of their heart health, and then will go and do the 100 kilometers every weekend. And these people now present in later age with quite advanced narrowings in their heart and in the arteries of their heart. And the sort of hypothesis is that if you haven't done any exercise, you're not accustomed to it, you start doing it, causes inflammation in the heart, and that kicks off rapid narrowings within the heart. It's exercise cardiology is a speciality in its own right, and there's a lot of interest in trying to understand, why this happens. But look, the overriding message is exercise is good for you, and everyone should, as a bare minimum, do those 30 minutes, 5 times a week. That's the absolute minimum. It is, the cohort of patients who you see who have the adverse effects of over exercising. It's a very small minority.
Okay. So correct me if I'm wrong. Does that mean a routine, for example, for exercise, that will be different for every person? So I need to get my heart checked and try and understand that what exercise is enough or best for my heart, because it's not important. It's not right that what my heart can take is okay for some other person as well, right? So
right.
it depends how much your heart can take, and every heart is different, like you said earlier.
Definitely, every heart is different. Every person is different, and if you've got underlying conditions, changes what you can do. So you get people who are born with very thick hearts, and the amount of exercise they can do is very different from, assume someone like yourself was born with a completely normal heart. So and also other conditions will, inform your decision. So as I said, exercise cardiology is now a thing. It's a subspecialty in its own right, because it recognizes the fact that, different people with different conditions will have different exercise requirements. You've got people with aneurysms in there, which means dilatation or enlargement of the blood vessels of their heart. They can do very little exercise compared to someone like yourself. So, you're right. Exercise has to be tailored to the individual. Exercise has to be tailored to any underlying conditions. But the general advice of 30 minutes moderate intensity exercise holds.
Okay. Let's talk about the future of heart health. Obviously, there's a lot of changes in the technology in the past few years, right? And now the AI is coming. What developments have you seen in the industry?
It's been huge.
Huge.
It's been absolutely amazing. So first of all, I want to talk about sort of wearable technologies. So we all have smartwatches.
Oh yeah.
Yeah, and the amount of data you get from there are phenomenal. In fact, again, speaking of my own experience, I have a 40-year-old sister-in-law, and her watch told her that her heart rate was 35 all of the time.
Yeah.
And she eventually ended up having a pacemaker. So these devices are. She had no symptoms whatsoever. No one knew that she was exercising. She was fit. There was absolutely no symptoms. But that was the first sign that her heart was misbehaving. Okay. So these are absolute godsends. We can get our VR2 Max, which is a measure of our fitness levels. We can even record an ECG with these devices.
Yeah.
It's now possible to even get bracelets which measure your blood pressure really accurately. The days of the cuffs are gone.
Yeah.
I read very recently that you can wear a bracelet that can tell you if you've had a heart attack. It can measure from your wrist whether your body's released an enzyme.
Oh, wow.
So, I mean, it's absolutely phenomenal. AI, I'm an imaging cardiologist, which means I do a lot of scans on patients, and a scan can read what I can read much faster and potentially much more accurately. So that's coming. I use AI every day in my consultations. I have a transcribing AI. It's ambient AI, which listens to my conversation, so I can talk to my patients.
Okay.
I'm not at a computer screen looking distracted. I can establish a rapport. Ambient AI right in the background transcribing my conversation. It'll give me my notes, much better than I could type myself. So AI, we're just beginning to see the advent of AI, and it's absolutely transformatory. In terms of the one sort of advancement I'd like to just very briefly touch on is a lot of heart operations. You have to go into operating theatre. Your chest is cut open. For example, if you need a new heart valve, it's a big. 10 years ago, this used to be a massive operation, and the recovery would be up to 3 months. We can now do the same operation while you're awake through the leg, and we can replace structures within the heart, like the heart valves. 1 hour. Most patients are home the next day. They can run. They can go to the gym after a week.
Wow.
It's phenomenal. So
Okay.
and that's the beauty of cardiology more so than any other specialities, that it embraces technology, it embraces change, and the practices that were cutting edge 10 years ago are now redundant because they're being replaced by all these amazing interventions.
Wow.
So it's phenomenal.
Okay. Are there any breakthroughs in cardiology that you're looking forward to for, like, I don't know, next 5-10 years?
Yeah, I think the one that excites me the most is because as part of my training, I did a PhD that was mainly sort of genetics based, and it is now that we understand a lot more about the genes that affect or predispose to certain conditions such as heart disease or diabetes.
Yeah.
We thought that when we did these gene studies, we would find the diabetes gene or would find the South Asian heart disease gene. We know that it's much more complicated than that. So there are hundreds of thousands of different genes that have small effects. If you have them, add them all together, they can predispose to high risk of heart disease or diabetes or whatever.
Okay.
So now it is possible, if you have these mutations, we can measure them and we can individually understand your risk. That technology is coming. It is now also possible to create medications that can target these specific genes and stop them from ever working, stop them from having any detrimental effects on your heart, on your cholesterol, on your blood pressure. So rather than being reactive, waiting for the heart attack and treating, or waiting for the high cholesterol and treating,
Yeah.
we can now nip it in the bud before, or we can, if these technologies work, and we'll find out in the next 5 to 10 years, then we can nip any problems in the bud before they can have any effect. I could be out of a job. I could be out of a job.
That would be treating. That would be amazing, but not your out of the job situation. So considering today's generation is so much aware of what they should eat, right? And they know that they need to do exercise, they need to sleep well, all that. And plus the technology and the advancements coming in the industry. Do you think the future generations would have healthier hearts or worse?
No, I would, I would hope so, and there's no excuse because, all this information is available to us on our tip of our fingers, on our mobile phones.
Yeah.
They're much more, the computers I played with as a kid,
Yeah.
Are nothing compared to what we have these days. So I think it's for parents, children, for parents, it's really important that you see all our kids scrolling on Instagram or whatever, and social media, and to try and show them the good aspects of the internet and this digital age where all this information is available. And it's up to us to make sure that we're informed. It's up to us to make sure our children are informed. And I'm completely convinced that this will translate into really good heart health. And the advances we're seeing now, we talked about wearable technologies, talked about using very non-invasive ways of understanding whether you've got, heart problems. We're much more well informed. It's a duty for all of us to be informed about our own heart health, not wait till a catastrophe arises.
Okay.
So,
Yeah.
but I'm very optimistic. I'm definitely a person whose glass is always half full. So I'm very optimistic that given all this information, one would hope that the future generation would embrace it. And the young people I meet, the very young people I meet, they always amaze me with their enthusiasm and
Absolutely. Yeah.
So I'm very confident we're going to have people routinely living up to 100, 120, probably after I've gone. But it's definitely something to aspire to.
Yeah. Hope so. Yeah. Great. So we're just coming towards the end of the podcast. One piece of advice that you would want to give our audience who actually do want to take care of their hearts.
Okay, it's a good thing, to be to be aware of your heart, to be aware of those modifiable risk factors. It's really important because these are simple and these are things that we can all address. Be it addressing your diet, increasing your levels of physical activity. If you're a smoker, to stop. So it makes a massive difference. My experience is that bad hearts happen with bad habits. It's not that you're born predisposed to having bad heart health. So the best way to to delay any problems with the heart is to address those. Look at yourself carefully, understand what you're doing well, what you're not doing so well, and then addressing those and trying to rectify those, because all these small interventions make a massive difference. And we all want to see our grandchildren, our great grandchildren, whatever. So there's no excuse for that not to happen.
Oh, thank you. Yeah, guys, do listen to that advice. It's very beneficial for you and your family. So at last, if our audience wants to reach out to you for any sort of advice, is there a way to reach out to you?
Probably the best way is through via LinkedIn. I have my own website where if someone wishes to come and speak to me, I can arrange an appointment. That my secretary's details are on there, so that's probably the easiest way if one wants to speak to me either face to face or do a remote review. I accommodate that. And those would be the sort of the two best ways of getting hold of me.
Perfect. Thank you. We will leave the details for Dr. Joban in the description box. So if you do want to reach out to him, please check out the description box. And we hope that you don't have to and you stay healthy. That's it. Thank you so much, Doctor. It was really nice having you here. You shared a lot of insights, and I hope it helps a lot of people.
Good. Well, thank you.
It's definitely going to help me.
Oh, brilliant. No, I really enjoyed it. I feel really honored to be invited. Thank you very much indeed.
Perfect. Thank you so much. And to our audience, if you found this episode helpful, then please like it, share it with your friends and family, and let's just spread out the word. We need to stay healthy and keep our hearts healthy as well. Until next time, take care. Bye.